How do you tell the difference between male and female?
Yeah, the swimmerette thing.
Okay, what about them? So which one's the male, which one's the female?
Male.
There's
Yeah,
no one on
that's
your
what-
left
Isn't
hand.
the male have-
This is the male.
It had, yeah, they kind of.
So you have the modified swimmerets into what are called, what are called gonopods. Okay. The opening to the male system here is actually right there at the end. The oviducal opening, the female is here and here. These little pads, you can see that you don't have that same structure there. So female. This is the annulus ventralis, little area there, that spot there. Your chelopads, maxillopads, we have our jaws. Okay, just jaws, we have the antenna, the antennules, we have a compound eye, We got the telson and the uropods. So the middle one's the telson, the rest are called uropods. So when you peel that off, that represents the carapace. This part here would be the rostrum. Go up into the head. Okay, we want to see if we can see the heart. See what we have here with what we have. Now this is the female, but if you look right here, that right there is the ovary. So if you get up close, if you're looking at underneath the scope, it would have some little eggs in it. And this tissue looks different than this. Okay, this other stuff is digestive gland, but that's the ovary. I have on your sheet testis, but I should be in the same place, but I've never seen something where I say, okay, point to it, and that's, or put a pin in it, if that's a testis. Yeah, but sometimes we get a nice ovary where we can see that. Now one of these has been cut down to the base. If you see where these two things come together, kind of right there, that's the, it's basically this brain's superior ganglion, cerebral ganglion or supraesophageal ganglion. Subesophageal you would find right behind the esophagus. Not as important as you're looking at this. So I've cut through the exoskeleton there internally. So that line, what line's going through the middle there is going to be your ventral nerve. So just an enlargement along that line would be a ganglion. So where these two connectives come together behind here, that would represent the subesophageal ganglion. These right here are muscles. So if we look at this one, here's my stomach. These are those muscles. They attach to the mandibles, so they're mandibular muscles. The gastric muscles are just these fibers on top here. I doubt that I would, if I'm pinning something here, I'm pinning for the stomach, not, I would ask or qualify the question. I was going through there. If you're looking at this, in that stomach, there's a hard structure. But there's one that's kind of torn apart here. Okay. So there's stomach here. So if we look inside, you see those teeth? Those teeth are referred to as the gastric mill. They're little chitinous teeth inside the stomach.
So the stomach's right behind the head.
Mm-hmm.
Right.
Yeah, I mean, I took that right off there. Where's that one? So there, if I bend that forward, you know, if I bend that forward, you see the two little nerve fibers coming up toward the head. Yeah, so here's our cerebral ganglion right up, about right there in that whitish area. Again, this is all stomach. This is that there. This is not separated out, but that right there would be the mandibular muscles. If I move this a little bit, see these little pads? That's the way I describe it. See little discs? Those are called the green gland or antennal gland. So it has an opening just underneath here. That's an excretory structure. Where an insect has Malpighian tubules, that's the excretory structure here. So as blood, this has an open circulatory system, so as blood flows over that, it's removing waste and then just dumps it out anteriorly. Now as we go down this way, from the stomach, okay, it's broken. So how many of you eat shrimp? Okay, it's not doing what we want to see. Try now. Okay, this is supposed to be like that. So do you want your shrimp veined or deveined? Yeah, so when they're talking about veined or deveined, it's not having to do with a blood vessel. It's having to do with that right there, which is actually the intestine. Yeah, so, I mean, this is the part you would eat, right? Well, most of us would eat. So this is the intestine here. It's obviously broken, would connect to the back of that stomach, come through here. Anus is going to be down here on the opposite side. And we have some muscles here also. So we have these along the side. It's not as good. So if I can find one that has the muscle still. Okay. So we have these muscle here, kind of on top, and then we have these other muscles underneath. You can see the fibers go different directions. So these on top are your extensors. They make the tail do that. These down here are flexors, make the tail bend downward. You've got the gills, or anytime you see the term tinea or tinida, C-T-E-N-I-A, that's referring to gill. Okay, what else we got there? So all this stuff here is digestive gland. Most of what we see is digestive gland. The claws, the cheliped. I think I already mentioned the maxillopads and the chitinous jaw. So I'm going to cut one of these and see if we can find a heart. And hopefully you guys won't tear it up. That'd be the rostrum. So we're cutting off the carapace. Okay, so our heart, if we have it, okay, this structure right in here is the heart. It has this membrane over the top of it. And when I'm bending that over, that's the heart right there. The ostia is a little hole right up here in the heart. So because this is an open circulatory system, this cavity would be a hemocele. Blood flows through that, goes through that hole, is pumped through vessels to the head and back this way. And then it's from the vessel it goes into, again, body cavities. Okay, so let's see if this is a girl, right? This is a boy. Yeah, there's probably some tissue there that's probably the testis. It's not something that would be pinned. I could pin the one on the female, but not that. Are we good? Did I hit it all?